may come in.
Hi, doctor.
Good morning, Mr. Bennett. How are you?
Good morning.
My name is Denise. I'll be your provider for today. You may have a seat.
Cool. I'm doing well. Long day.
So, can you tell me what brought you into the office today?
I believe I need to get a test done.
Okay. Can you just tell me your state your full name?
My name is Joshua Bennett.
And what's your date of birth?
December 9th, 1999.
Can you tell me what you had for breakfast this morning?
I had a bacon, egg, and cheese sandwich.
Okay, and also, can you tell me who is the current president of the United States of America?
Joe Biden.
Okay. So today we're going to do, I know last week you came and we did some exam.
Oh, yes.
So today you're just going to do a neurological exam and a musculoskeletal exam, okay? Now, if the room temperature is too cold or too warm, just let me know. While I'm doing this assessment, if you're experiencing any kind of pain or any kind of discomfort, please free to let me know, all right? So first, I'm going to ask you to use your finger to touch my finger. I'm going to ask you to take it back to your nose several times. Touch my finger several times, back and forth.
Okay.
Okay? Several times. Go back and forth. Use your other hands. We're going to alternate. Okay? All right? All right. Now I'm going to ask you to stand. I'm going to ask you to ask you to follow my finger. I'm going to go up. I'm going to come down. Just use your eyes to look down.
Okay.
I'm going to go the other way. Right?
I'm
going to come back here. I'm going to go down. Okay. Now I'm going to ask you, we're going to do a heel to chin, right? To the shin. You're going to use your heel opposite to your shin, rub it down, go all the way down to your greater toe. Great. Can you also do your next opposite foot? How are you doing?
It's good. Tricky.
Okay. Feel like you're balancing?
Yeah, I have good balance.
Okay, so I'm going to ask you to just have a seat.
Okay.
I'm going to ask you to strike your hands on your thigh back and forth. Turn it over as fast as you can, as fast as you can. Okay, great. Thank you. How are you feeling?
I feel good.
Okay, any joint pain, any soreness, any tenderness?
No, I feel good all around.
Okay, all right. So I'm going to ask you to do a test that we call a Romberg test. Whereas you're going to stand. I'm going to ask you to stand.
Okay.
Put your foot together and close your eyes.
Close my
Hold your
eyes.
heads up. Hold your head up midway. Yes. Close your eyes. All right. You may be seated. How does that feel?
Good.
Now I'm going to ask you again to stand. You're going to do a normal walk. You're just going to walk over to that door. Normal walk. That is to check your posture and your balance.
Okay.
Walk back this way. Okay, great. Now I'm going to ask you to walk on your heels.
Walk on my heels.
Yes. There you go. Okay. Any pain? Any muscle soreness?
No.
Okay. Now I'm going to ask you to walk on your toes to come back to me. Now I'm going to ask you to do a particular walk that we call tandem walk, whereas you're going to put your heel.
My heel.
And then you go to toes. Heel.
From heel to toe.
Toes. From heel to toes. 1 foot in front, 1 foot in back. Heel to toes. Alright? And you come back to me. How is that?
It's good.
Okay, so now we're going to do something called a shallow knee bend, all right? You're going to tippy toe and bend your knees. Go on your tippy toes and bend your knees. How does that feel?
Good.
Good. One more time. Okay. Okay, you may be seated. Now I'm going to do a sensation. I'm going to use 2 different objects and you're going to describe the sensation that you are experiencing. I'm going to do this on the upper and the lower extremity. So your upper extremity, I'll just do the arm. So tell me if this is a sharp pain or it's a dull pain.
Oh, that's sharp.
Sharp, okay. Tell me if this is and describe this, what is this?
This feels soft.
Okay, so that's for the upper extremities. Now can you extend your feet?
My feet.
Yes, I'm going to do the same thing. Can you just pull your pants up a little bit for me, sir? Is this a sharp pain?
Ooh, that's sharp.
Okay. Is it a sharp pain?
Sharp.
Okay. And this is a?
That's soft. Soft.
Okay, thank you, Mr. Bennett. You may extend your light. Now I'm going to use this that we call a turning fork. I'm going to make a sound and I'm going to have you tell me when the vibration stops. I'm going to ask you to state when it stops. So I'm going to knock here. You feel the vibration?
Yep, it's stopped.
One more time. And mastoid process. Feel it stop?
It stopped.
Okay. Now I'm going to ask you to stand. I'm going to assess your tricep muscle.
Oh.
All right?
Okay.
So I'm going to ask you to extend, right?
Mm-hmm.
Palm down,
Palm down.
right? And I'm going to use my, I'm going to just do tapping. I'm just checking it, okay?
Okay.
You feel the vibration?
Yep, I do.
Okay.
Yep.
Right? Okay, then you're going to do tricep.
Okay.
Tricep. Tricep. Bicep, I'm sorry. This is the bicep.
Okay.
We're going to check.
Mm-hmm.
How does that feel?
It feels
Okay,
fine.
good. Let's do the tricep one more.
Okay.
Okay? How does that feel?
It feels fine.
Okay, let's do the opposite. How does that feel?
My bicep feels fine.
Okay, okay, let's do the tricep.
Okay.
Okay, now we're going to do brachioradial. We're going to put both forearm out.
Mhm.
Okay? We're going to pronate that and I'm going to check up here. How does that feel?
It feels fine.
How does that feel?
It feels fine.
How does that feel?
It feels fine.
Okay, so I'm going to ask you to have a seat again.
Okay.
How are we doing?
I feel good.
Okay, so I'm going to ask you to, I'm going to have a seat here. I'm going to ask you to extend your knee.
Extend my knee.
Extend your knee. Just do one knee at a time. I'm going to check your patella, which is back here. I could feel your on pain,
No pain.
no swelling,
Mm-mm.
no tenderness. All right?
No.
Dangle your feet. Put it down and dangle. Okay, great. I'm going to check for your Achilles.
Okay.
Okay, I'm going to hold this here. Right, it's right back here. Any tenderness?
Mm-mm.
No pain?
No pain.
Okay, I'm going to dorsiflex towards you. Relax as much as you can. And I'm going to come back here. All right, I'm going to also check your tendon again. Check these muscles back here. Tell me if you feel any pain.
No pain.
No pain, okay. So we're going to do a plantar. I'm going to ask you to just relax a little bit.
Okay.
And I'm going to strike the sole of your feet.
Ooh, that tickles.
No pain.
No pain.
That reaction is within the norm.
Okay.
My glasses. Let me fix my glasses. Okay. All right. Okay, you want to stand? We're going to the next. Now we're going to check your musculoskeletal system. All right. So at this point, I'm going to ask you to turn around. And I'm going to check your cervical spine and your cervical muscle. So I'm coming down here. Any pain?
No.
Everything seems aligned. No nodules. Symmetrical. I'm going to check your scapular area, the cervical area, the neck of your trapezium and your scapular area. Everything seems symmetrical. No pain.
Oh, thank
I'm going to
goodness.
palpate this area just to check and see. All right, I'm going to inspect your shoulder. Can you turn around, please?
Turn
I'm
around.
going to inspect your shoulder. No dislocation, no pain,
Mm-mm.
no swelling. Okay, I'm going to inspect. Everything is symmetrical. All right, no deformity noted. Now I'm going to already palpate. No pain, right?
No pain.
No pain. Okay. Muscles all intact. All righty. Now I'm going to ask you to I'm going to ask you to extend. I'm going to inspect your elbow.
My
Right?
elbow? Okay.
Yes. I want you to flex it to 90, to 70 degrees.
To 70?
70 degrees.
Okay.
No swelling noted, no nodule. You could put it down.
Okay.
I'm going to check the ulnar nerve. No swelling. Check
No swelling.
on both sides of your elbow. No swelling.
Bend the elbow.
Yeah, to 70 degree, please.
Okay.
Okay, no swelling noted. All right, now I'm going to take a look at your wrist and your hands. I want you to move them in motion. Your wrist and your hand. Move, rest, move, up, down.
Mm-hmm.
No bony deformity. Let me just check. Check. Everything seems in line. Any pain?
No pain.
Any tenderness?
Nope.
Fingers are separated?
Yep.
Okay. Just do some movements again.
Okay.
All right, now I'm going to ask you to have a seat. I'm going to inspect your knee.
My knees.
Okay. I'm going to just check. All right, I'm going to inspect. I'm looking around. Okay. Okay. Knees in place, no sound. Have you ever had an injury to your knees?
Nope. My knees
Okay.
are strong.
Okay, no swelling, no deformity.
Nope.
I'm going to do both knees.
Sorry.
Okay. Flex the knees. Patella is intact. No swelling.
No
Let me
swelling.
pull those down. Now we're going to check your ankle, feet, and your toes.
Okay. Do I take off my
Yes,
socks?
please. Can you remove your socks if you don't mind, Mr. Bennett?
Oh man. They might smell.
Okay, let me just check your toes. Your pulse is present. No edema noted. No swelling, right?
Mm-hmm.
Okay. Move your toes. Any tenderness?
Nope.
Check the Achilles. Palpate the Achilles. The joints, anterior, posterior feet seems very good. Let me just check your other feet, please.
Okay.
Pulse is present.
Mm-hmm.
No edema noted. Dorsiflex. The Achilles in place. Okay. All right. How we doing?
I feel good. Can I put my
No.
socks on or?
No, you could just leave your socks off.
Okay.
Now we're going to do some exercise. We're going to do exercise range of motion of your neck. Okay. We're going to assess your neck muscles to see how strong they are.
Okay.
So I'm going to ask you to do flexion. Okay, flexion.
Should I stand up?
Yes, please. You may stand. Do flexion. Flexion it. Extend. Okay. Flex, extend. Then you're also going to do rotation. Go to the left. Go to the right. Okay. You're going to bend. You're going to look up to the ceiling. Down. You're going to use your chin into your chest.
Mm-hmm.
Okay. Hold it down, then you relax. Okay. Look to the side. Look to the right. Okay, I'm going to check your strength of your neck. So you're going to go this way. You're going to go this way.
Okay. And resist.
Yeah. Okay. Okay. Okay, Mr. Bennett, you may be seated. So now we're going to test range of motion muscles of your upper extremities. So your shoulder, we're going to do your shoulder, your elbow, and your wrist, and your hand. So you're just going to stand again.
Okay.
This requires a lot of standing. So you're going to move your shoulders inward, right, outward. You're going to go adduct away from the body, right, up to shoulder level with palm down.
Palm down.
Right, and then above the head with palm up. Right, with palm turned up. So we're going to go this way, palm down, above your head with the palm up. How are we feeling?
I feel good.
Okay, and the muscle strength and the muscle weakness and the muscle pain. Okay, now we're going to do adduction. We're going to ask you to cross your arm in front of your body. This is a good time to take a deep breath. Okay. So now we're going to do the elbow bent to 90 degree. You could sit. Elbow bent to 90 degree.
Okay.
And then raise arm to the shoulder. Raise your arm to your shoulder. Okay. Rotate. Forearm. Then we're going to do an internal rotation. Place your hand behind the back. Touch your shoulder blade as much as you can. You probably want to stand if it's easier for you, sir. So this is internal rotation. You're going to place your hand behind your back.
Okay.
Right, and touch your shoulder blade. How does that feel?
That's a deep stretch. Feels good though.
You didn't hear no creaking sound, right? Okay, so we're gonna do shoulder stress. We're gonna do adduction, add, away, and close. Away and close. How does that feel?
I feel good.
Now we're going to turn your palm down. Your palm down. Okay? And then you're gonna straighten out your arm. Keep your palm down. Then you do supine, turn your palm up. How does that feel?
Feels fine.
Okay, down, pronation down, supine up. Okay? And we're gonna do some strengthening of your elbow. Your elbow, you're gonna do flex. Okay? Extension and flex. Okay, now I'm gonna check your wrist. Range of motion of your wrist, flexion, extension. Finger point to the floor. Okay? Your wrists are very flexible.
Thank you.
Okay, so we'll go to the next. How are we feeling?
I feel good. A little cold, but I feel good.
Okay. Next test, please. We're gonna do the next test for you. Want to take a deep breath?
Yep.
All right, we're gonna do strengthen the wrist. Okay, make a fist.
Make a fist.
Make a fist out to the front. Like you just do this. A little pushed. Ooh, I'm sorry. Just a little push.
Okay.
I'm checking your resistance. Okay. We're gonna do hand grip. Place middle finger on top of the index finger. Middle finger on top of the index finger.
Top of the index finger.
Right, and then you're gonna squeeze finger as hard as possible. Attempt to both sides. Okay. Now we're gonna do range of motion of the finger. All right, we're gonna make a tight fist, flex. Yes, and extend. Spread them out. Spread them apart. Bring them back together. Apart. Together. Apart. Together. Now we're going to do the strength of the finger. We're going to spread the finger apart, right? Spread the fingers apart. Try to force them together by pressing on the lateral aspect of the index forefinger. So spread the finger apart. Try to force them together by pressing on the lateral aspect of the index finger. So get to the lateral aspect of the index finger.
Like this?
Yes. Okay. Very good. We're going to do one more test, all right?
One
How
more.
are we feeling?
Man, I feel like I'm in the gym.
One more test, please. Just take a deep breath. Is it room temperature okay for you?
Yep.
You have any questions?
How I'm doing so far?
You seems to be cooperating.
Okay.
Yes. Yes. Okay. So we're going to just do a few more exercises again. Now we're going to do a range of motion of your hip. I'm going to ask you to have a seat. This is going to be kind of a little challenging based upon it, but in general, you have had a nice table in the other office where you could more lay out. So I'm going to ask you you're going to sit in the chair. I'm going to place my hand underneath the lumbar area, and I'm going to ask you to bend your knees to knee chest position. Actually, you could recline, extend the feet of the chair. This chair can recline. Thank you. So I'm going to place my hand under the lumbar. That's good enough. Oh, that's great. Lumbar. Okay, I'm going to ask you to bend your knees to chest and pull it firmly against the abdomen. There you go.
Like that?
Yes. Stretch it out again. I'm just checking the lumbar area here, and I'm going to ask you to, there you go. I'm going to ask you to bend your knees to the knee chest there against. Okay, great. Now I want you to stay in that position, and put your knees to the left towards the ceiling. I want you to use your knees elevated towards the ceiling as much as you can tolerate. This is a little bit challenging. Are you having any dizziness, any headache?
No.
Okay, very good. Now I'm going to ask you to stand. Good, put your foot down. Thank you. Ask you to put yourself into a supine position again.
Okay.
Okay, I want you to be in a supine. You're going to have to actually sit.
Okay.
One hand over lower leg. Okay, put one hand over the lower leg, right? Towards the midline. Just stretch. Okay. This is not an ideal location, but we're going to just do that. All right? So then we're going to do another rotation, internal and external rotation. Okay, you're going to be seated and you're going to flex the 90 degree. Flex Flex your legs to 90 degree. Your legs. Relax your hand. Flex both legs to 90 degree. Okay, and I'm going to do a little rotation here. Any pain, any pain?
No.
Okay. All right, so you're going to remain in that position. We're going to test the strength of your hip. So you're going to be seated, hands on your thigh. I'm going to ask you to raise your legs against resistance. Okay, raise your legs. Both legs. I'm going to slip my hand under. Okay, and I'm going to ask you to push down by lateral and flex rotation. Any pain?
No.
Okay, all right. Then I'm going to ask you to adduct. You're going to be seated,
Okay.
legs relaxed. Place your hand on the lateral aspect of both knees. Lateral aspect of both knees. All right, and offer some resistance. Okay, offer resistance to further. Okay. All right, next. You could stand. How are we doing, Mr. Bennett?
I'm doing well.
So now we're going to do a few more exercise and this will be the end of this test. All right, so now we're going to do range of motion of your knee.
Okay.
So I want to ask you to do flexion again. You're going to be sitting at the edge of the chair. You could have a seat on the chair. Come towards the edge, right?
Yeah.
Bend your knees,
Okay.
okay, and straighten out.
And
Bend,
straighten them out.
bend, right? That's straighten. Do bending first, bend, and then you extend them fully.
Okay.
All right? Great. Okay, great. Very good. All right, that's the flexion. Now we're going to do an extension. You're going to fully flex position and straighten the knees. I'm going to have you squat. You like a squat to stand. All right, a squat. You're going to bend your knees. All right, how is that?
Good.
Any pain in the lower back?
No.
Any pain in the knees?
No.
All right, sit down. Now we're going to do, I'm going to have a seat to help assist you in doing this one. We're going to do internal and external rotation. So you're going to be sitting right there on the exam table. You're going to place your hand on your thigh to keep your thighs stable, right? And then your femur, I'm going to grasp your leg, right? And I'm going to rotate. I'm going to rotate medial and lateral. All right, next leg. Okay, medial and lateral. Okay, how are we doing?
I feel fine.
All right, I'm going to also do your knee strength. So we're going to do flex and extend of your knee. So I'm going to have to place your hand on the chin here, place your hand here. I'm going to ask you to, I'm going to put some resistance, curl your fingers around, low, resistance, okay, very good. Now we're going to do some range of motion of your ankle, right? We did something similar earlier, just want you to just rotate your ankle in and outward, okay? Inversion and eversion. Okay, I'm going to grasp your heel again. I'm going to grasp your heel. I'm going to go in. Any pain?
Nope.
No tenderness. Next foot, please. No. Rotate in and out. All right, inversion and eversion. Okay, put them down. So we're going to do the stretch of your ankle again, which requires us to lift your feet again. All right, I'm going to dorsiflex towards you.
Ooh.
And you're going to plantar towards me. How does that feel?
Feels good.
No clicking sound, no pain?
No.
All right. Pretend you're stepping on a gas pedal. Press.
Okay.
Press.
Okay.
Right?
Like that?
Yes. And then back to you.
Okay.
All right, let's do the other one.
So
So-
add pressure.
Yes, put some pressure here towards me, like
Okay.
you're also on a gas pedal. All right. And then you're going to try do some resistance, okay?
Okay.
Then we do range of motion of the toe, right? Medial and lateral, extension in, out, all right? And the last thing we're going to do is to assess your spine alignment. All right, Mr. Bennett, so could you please stand?
Turn around.
Just turn around. And I'm just going to, I checked earlier, but I'm going to do a final check that your spine is aligned Thank you so
Is it a
very
line?
much. Yes, it's a line. Thank you very much, sir. You could reach the office within the next 2 days for a follow-up of your result.
Thank you, doctor. It's nice meeting you.
Nice meeting you.